Let's look at preparations before using the Pentax AWS. The Pentax AWS is used with the P-blade. The P-blade is provided in a sterilized package. Inspect the package for damage. Do not use if the package is torn or punctured. Wear sterilized gloves before handling the P-blade to avoid contamination. It is particularly important to keep the P-blade tip clean as it is inserted into the pharynx. After opening the package about a third of the way, hold the connector and remove the P-blade from the sterilized package. Locate the triangular marks on the connection ring of the Pentax AWS and the connector of the P-blade. Aligning the two triangular marks is required for proper assembly. The lock ring must be in the unlocked position to attach the P-blade. Hold the Pentax AWS so that the monitor faces downward. Do not hold the Pentax AWS to the side or with the monitor facing up. Do not hold the scope in an upright position. Insert the flexible tube of the Pentax AWS into the connector of the P-blade. Confirm proper positioning by aligning the triangular marks on the Pentax AWS connection ring and the P-blade connector. Attach the P-blade to the Pentax AWS by pulling and holding the connection ring while inserting the P-blade connector securely. Release the connector ring to attach the P-blade. Confirm that the scope tip contacts the scope window of the P-blade. Secure the P-blade by engaging the locking mechanism by fully turning the lock ring in the direction of the arrow. Confirm that the Pentax AWS and P-blade are securely attached. Before using the Pentax AWS, apply a medical-grade anti-fogging agent to the outside of the scope window of the P-blade. This will ensure a clear view on the monitor by preventing fogging in the scope window which may occur during insertion into the mouth. Only medical-grade anti-fogging agents should be used. Prepare the endotracheal tube. Use the appropriate sized endotracheal tube. Remove the air from the endotracheal tube cuff before use. Lubricate the endotracheal tube with a medical-grade lubricant. Do not place an excessive amount of lubricant on the endotracheal tube or lubricate the endotracheal tube guiding groove of the P-blade. Slide the tip of the endotracheal tube into the guiding groove of the P-blade as shown. Place the endotracheal tube into the hook and confirm that placement is secured. Exercise care when placing the lubricated endotracheal tube into the guiding groove to avoid getting lubricant on the scope window of the P-blade. When inserting the endotracheal tube in the guiding groove, position the tip of the endotracheal tube at the end of the guiding groove, as shown. Ensure that the endotracheal tube tip is neither protruding over nor withdrawn into the guiding groove. Make sure to adjust the tube to its proper position. Let's look at proper oral cavity insertion as well as flawed methods. Turn on the Pentax AWS. Confirm that there is an image on the monitor and light is emitted from the scope tip. Hold the scope in the left hand as shown. Slowly insert the epiglottis lifting blade into the mouth. It is essential that this procedure be observed with your own eyes to prevent trauma to the mouth. The following illustrates improper insertion technique of the P-blade into the mouth while exclusively relying on the monitor. This could result in possible damage to the teeth and lips. The correct insertion method is highlighted on the screen. While confirming insertion, keep the scope in the midline position. For patients with a large chest or in the case of cardiac compression, insert the scope into the mouth at a slight angle, then return it to the midline position for a proper insertion. Verify the epiglottis on the monitor and gently slide the lifting blade under the epiglottis and then slowly raise it. When the glottic opening can be seen, position the target symbol over the opening accordingly. This is the proper insertion method, whereby the blade is inserted in direction of the esophagus and then pulled back. Let's now look at various improper techniques. If the scope is straightened too early, it won't penetrate deep enough and will push against the tongue. Such a case is highlighted on the screen. As with previous laryngoscopes, there is a possibility of entering the radix linga. This situation in clinical practice is highlighted on the screen. When inserting the scope too deep, it can hit the arytenoid cartilage. Please take a look at the screen. The screen highlights a situation where the blade is pushing against the epiglottis. Cases like these are shown on the screen. Let's turn to endotracheal tube insertion and removal of the P-blade. When the target symbol and glottic opening are aligned, insert the endotracheal tube by gently pushing it forward until the marker line reaches the glottis. After confirming proper placement by viewing the monitor, detach the endotracheal tube from the hook. Firmly hold the endotracheal tube while slowly withdrawing the P-blade from the mouth. When there is a large amount of secretion such as saliva, a suction catheter may be inserted into the P-blade for aspiration. The maximum catheter size is 12 French. Insert the suction catheter into the suction catheter insertion port and push it until it extends out of the suction catheter hole. Aspirate secretions while viewing the monitor. The procedure to remove the P-blade is the exact reverse of attaching it. Turn the lock ring fully to the right to unlock. Pull the connection ring on the Pentax AWS to release the P-blade. Slowly turn the P-blade clockwise while pulling to remove. Exercise care when removing the P-blade. Scope tip damage may occur if excessive force is used to remove the P-blade. If the lock ring is not fully turned to the unlocked position, the P-blade will remain locked. The lock ring must be fully turned to the right to release the lock. Remove the P-blade by gently twisting it to the right. Now a guide to Pentax AWS maintenance. Wash all surfaces with gauze soaked in enzymatic detergent. Gently rinse under running tap water. Wipe all surfaces with gauze soaked in ethanol. The concentration of the disinfectant is between 70 to 80%. Do not immerse the Pentax AWS in water or ethanol. Do not use soap water, neutral detergent, or ultrasonic cleaning. Images may be transmitted to an external monitor. Note that the image output terminal cover is opened by turning it clockwise. When connecting the image output cable, insert the plug firmly into the terminal of the Pentax AWS.